We're facing a potential crisis, really, with antimicrobial resistance in human medicine in the United States.
What we do to our environment ultimately comes back to us in the food we eat or in other pathways of exposure.
Now there's some very glaring examples that if we overprescribe antibiotics, that it actually creates antibiotic-resistant organisms and higher death rates in subsequent patients who no longer can fight those infections. But we also understand that if our patients are eating antibiotic-laced foods, through animal foods largely, beef, dairy, eggs even, things like this, that we actually get the residual of those animal applications, and that gets essentially into our patients.
We've seen epidemic increases of a variety of chronic conditions that can be traced to chemicals commonly found in foods. Just look at the obesity epidemic. We've seen a tripling in the rate of childhood obesity in the United States today. We also have increases in a variety of neurodevelopmental conditions. These include attention deficit hyperactivity disorder, autism, and learning disorders. In addition, we know that certain synthetic chemicals commonly found in these foods can actually disrupt reproductive development, both in boys and in girls.
The major element in the emergence of antimicrobial resistance is misuse of antimicrobials. 50 to 75% of antibiotic usage is not necessary. So if you're not using antibiotics appropriately, either in patients, in the environment, in animal husbandry, you're going to get inadequate drug exposures at the site where the bugs are living. And if there's not enough drug around, it's inevitable that microbes, bacteria, fungi, viruses are going to develop resistance to that. If antibiotic resistance hits a certain threshold, then modern medicine itself becomes impractical, right? You can't do complicated abdominal surgeries. You can't do transplantation.
Most of the bacteria that we're being exposed to are beneficial bacteria. It just so happens that if there's some sort of disruption, like you cut your skin or you get a virus or something like that, then that disruption will lead to like a handful of bacteria that are not beneficial, so pathogenic bacteria, that rise up. And then you have a bacterial infection and you take an antibiotic for that.
Over 80% of total antimicrobial use basically goes into animal husbandry. And there's a large amount of antimicrobial use that goes into agriculture and crop raising and what have you. And the reason antibiotics are used in animals and they're used in plants is to basically limit disease and to improve yield and production. And all that is generated, well, not all of it, but the bulk of it is generated toward food production. And the pressures we face now with need for increased food production, exploding global populations, the challenges in the way these have changed, say with things like climate change, it's just sort of upped the pressures we face within this system. Big Pharma, historically the companies that over the first 70 years of the antibiotic era drove innovation, brought these products to market, and saved untold millions of lives, they've really gotten out of the drug development game. And the overarching reality is that the economic model is completely and utterly broken, and the remuneration for antimicrobials is insufficient to keep companies, big or small, really in the development space.
What little we know about chemicals that scramble the basic hormonal signals in our body and ultimately contribute to disease is that they cost us as an economy $340 billion, that's billion with a B, each year. That's an annual cost insofar as exposures continue at current levels. And that's based on fewer than 5% of chemicals known to mess with hormones, a subset of diseases due to those chemicals that we studied, and a subset of costs due to diseases due to those chemical exposures. So we're hitting at the tip of a proverbial iceberg. We did a study looking at BPA in aluminum cans. It's still used in most aluminum cans. And what we did was to model a scenario in which BPA was substituted with an ingredient free of hazards. Now, that's not been defined exactly yet, and we have a little work to do before we identify that substitute. But for one oleoresin, the cost would be 2.2 cents in the can, which is $2.2 billion a year. Then we modeled just 2 disease outcomes that we thought could be reduced, and we found economic benefits on the order of $1.7 billion. So we're almost talking about a wash. And that is an underestimate based on all the other disease outcomes that are increasingly being associated with BPA. And in some scenarios, modeling some uncertainties in our analysis, we actually found benefits greater than the cost of that safer alternative. So avoiding canned food consumption is a straightforward way to limit your bisphenol exposure. Also, saying no to that thermal paper receipt that leaches BPA into your skin and into your body is another straightforward way. We're seeing a lot of electronic receipts replace these thermal paper receipts that can be impactful. Also, we think of microwave safe as good for you, but the reality is at a microscopic level, there's leaching of these plastic contaminants into food and into our bodies. The same goes for avoiding machine dishwashing plastic containers. Hand washing is a better way to go. And there's always glass.
There's a potential for crops and plants to take up antibiotics and or even have antibiotic resistant genes on them or in them. And so if you're making food choices of meats and vegetables that you know would not have that contamination, you essentially cut that cycle off.
To really see the benefits that we want for the planet and our health, we need to have an interdisciplinary dialogue. We need to continue the conversation with everyone, not just dietitians in their silos, not doctors in those silos, not environmentalists. Everyone coming together to say, you know, this is what I'm recommending to my clients, this is what I'm doing on the farm, and to make sure that everyone is aligned and reaching towards the same goal.
I want people to be aware of what's going on and that we need to work towards solutions. I don't know I necessarily have all the solutions to it, and that's why, you know, one person can't do it all, or one group of scientists can't do it all. And that's why this symposium is so important, because it's bringing together various different scientists who are all concerned about this one health issue. We may be studying different things, like I'm studying antibiotics, but someone else is studying animal husbandry. But whatever the case, we're all linked together, and we all need to be working together.